she has seen. Oh, the meaner side of me. They took away the prophet's dream for a prophet on the street. Now she's stronger than you know. A heart of steel starts to grow. All his life he's been told he'll be nothing when he's old. All the kicks and all the blows, he won't ever let it show. Cause he's stronger than you know. A heart of steel starts to grow. When you've been fighting for it all your life, you've been struggling to make things right. That's how a superhero learns to fly. When you've been fighting for it all your life, you've been working every day and night. That's how a superhero learns to fly. All the hurt, all the lies, all the tears that they cry. When the moment is just right, you see fire in their eyes. Cause he's stronger than you know. A heart of steel starts to grow. When you've been fighting for it all your life, you've been struggling to make things right. That's how a superhero learns to fly.
Good morning or good afternoon, everyone. Welcome. As we kick off things today, I just want to thank you all for being here. My name is Lily Banning, and I am the Community Impact Director with the American Heart Association. And I'm here today because heart disease disproportionately impacts the construction industry. And that's why the American Heart Association is so committed to our initiative, Hard Hats with Heart. This campaign focuses on improving the health of the industry so that we can see an end to statistics like 1 in 25 craft workers have diabetes, or 1 in 4 are struggling with obesity, or 1 in 4 craft workers are diagnosed with high blood pressure. So before we begin, just a few housekeeping items. Just letting you all know that today's event is in webinar format. So even though we cannot see you, we still want to hear from you. You'll see in the chat there's an opportunity to plug in any questions that you have. We do have time at the end for Q&A, but just make sure that you're selecting all panelists and attendees from the drop-down menu when you write that question in. And if we want to do a little test, type in the chat where you're joining us today. Where are you located? Are you in Portland? Are you outside of the city? Are you sitting in your living room? Are you at the office? Just give us a sense of where you're at so that we can make sure everybody sees in the chat, and make sure to select that all panelists and attendees. Thank you. All right. Nice to see some familiar names and faces, and thank you all again for joining us. So let's dive in. On the agenda today, you will all learn about this urgent need to address tobacco use and e-cigarettes, the truth and the lies that are spread about tobacco use and vaping, as well as the impacts of secondhand smoke. And we're going to really focus on what you can do, whether you're an employee, a supervisor, an executive, how you can get involved in reducing the number of deaths related to tobacco use and vaping in the construction industry. So get ready for some tools that you'll be able to apply to your job and your workplace. And next, I'm going to introduce our Hard Hats with Heart cabinet member, our 2020 Heartball chair, and the president of and CEO of Hoffman Construction, Dave Drinkward. Dave?
Thank you so much, Lily, and welcome everyone. Hoffman's proud to join forces with the American Heart Association through the Hard Hats with Heart campaign to bring awareness to all of these health issues that exist in our industry and to work together to create the sustainable change that we all want to see. It's critically important that we step up as an industry and start to change some of those numbers that Lily just shared with us. So it's professionally important for all of us. For me, this is also personal. Like many of you, I'm sure, I've had family members who have struggled with using tobacco. One of them was my grandpa, my mom's dad. He was kind of your classic grandpa. He was gregarious. He was hilarious. He was always the life of the party, wore cowboy boots most of the time, and he also smoked cigars for most of his life. And I remember as a kid, he would always joke as he lit up, he would chew on one end of the cigar and he would light the other, and he would race the cigar to the middle. That was kind of the way he approached it. And I think he tried to downplay the impact of his smoking by making light of it. Sadly and predictably, he passed away in his early 70s from congestive heart failure. And I'm sure that tobacco played a significant role in that, if it wasn't the leading cause. So, it's just sad when you think back and look at, all the life that he had yet to live and all the joy that he could have brought to the world. He never got that chance. So it's critically important that we address this issue of smoking and tobacco use head on in our industry, and so that we can change the culture. Smoking is the most preventable cause of death in the United States. And sometimes it feels like we all know that smoking is bad, but I think it's really critical that we dive in and really understand the actual impact that it has, educate ourselves, wrap our heads around all of these facts. And so to start, I did a little research. Almost 1/3 of deaths from coronary heart disease are linked to smoking. Smoking increases your risk of heart disease and stroke by 2 to 4 times. On average, smokers die 13 to 14 years earlier than non-smokers. And nationally, about 15% of Americans smoke, but in our industry, that number is closer to 25%, which is just staggering to me. Although I think we all see it when we visit job sites and see it around our offices. So we're not doing so hot. And I think we're all here to ask ourselves why that is and what we can do about it. So together, it's time to take action individually and collectively. And I think through a combination of educating ourselves, getting access to these types of tools like are going to be shared today, we can all make a difference and make a healthier workforce. So thank you again for being here. My hope is that all of you listen and engage with this and then take something away. I think we all attend these things and we all think we know a lot about a topic. We all think we're doing the right things, but there's always a nugget or two that we can take away and put to use either in our organization, our team, our job site, or even maybe your family or for yourself. So again, Hoffman's honored to partner with the American Heart Association on this initiative, and I believe together we can drive the change that we want to see. With that, I'm going to turn it over to Alexa Warman, who is our expert and going to lead the conversation today. Thanks.
Thank you, Dave. Hi, everyone. Alexa Warman. I work on public policy for the American Heart Association across several states, including Oregon. I just wanted to talk a little bit about some of the health impacts that tobacco use causes. And Dave went into this a little bit. He shared some really important stats. I think all of us are pretty familiar with what tobacco use and smoking does to our health, but it's always good to have a refresher and a reminder of why we care about this issue and how smoking impacts our heart health. Dave said that tobacco use is the leading cause of death, preventable death in the country. The same is true for Oregon. It's the #1 cause of preventable death and disease in the state. And each year, smoking-related diseases kill nearly 8,000 Oregonians. I want to pause and reflect on what I mean by tobacco use. It's not just cigarette smoking and cigar smoking, it's also chewing tobacco and e-cigarette use. I'll talk a little bit more about e-cigarettes and vaping and what those products are and how they affect our health. But just to level set, when we talk about tobacco use, we're talking about all of those products. I also want to mention that it's not just the smokers and the users of tobacco who are affected by these diseases and death, early death. It's also individuals who are exposed to secondhand smoke. So even non-smokers can suffer from heart disease, lung disease, cancer, just by being exposed to secondhand smoke. And that usually happens either in the home or in the workplace. So secondhand smoke is also deadly. Next slide. Thank you. So e-cigarettes and vaping. I think a lot of us have heard a lot about these devices, especially in recent years, and it's really been brought up as an issue surrounding kids and youth who are picking up these products. Yes, that is a problem. But I thought it would be helpful just to get a level understanding of what these products actually are and how they affect our health. So just to quickly go over, e-cigarettes and vape devices are two names for the same type of product. They are handheld devices that contain the addictive substance, nicotine, that occurs naturally in tobacco, but at very high levels. E-cigarettes were brought on the market and were falsely advertised as a safe alternative to cigarettes. The tobacco industry really wanted to advertise these products as a way to help adult smokers quit smoking. On the face of it, that sounds like a great idea. It sounds like a great resource for our adult smokers. But the problem is that these e-cigarette and vape devices contain a lot of the same toxic chemicals as are in cigarettes. These toxic chemicals are linked to the same diseases, heart disease, respiratory disease, and cancer that cigarettes are linked to as well. The bottom line is that e-cigarettes and vape devices are not proven methods for quitting smoking. They haven't been approved by the FDA, and ultimately they are not risk-free. They still pose a risk to our heart health and our overall health. Thank you. And so this is where the Heart Association has poured resources into helping adult smokers quit. We know that all tobacco products, including e-cigarettes, are damaging to health and heart health. And there also is a lot of research behind the health benefits of quitting smoking. It might seem intuitive, but people who stop smoking greatly reduce their risk for disease and early death. And there are benefits for quitting smoking or tobacco use at any age. It's never too late. In fact, there is a lot of research that shows that if somebody quits smoking before the age of 40, they reduce their risk of dying early from a smoking-related disease by 90%, 90. That's a lot. And so the Heart Association is committed to helping people quit smoking. And one of the best ways we know how to do that is by helping their workplaces go smoke and tobacco free. Not only does going tobacco free help reduce the secondhand smoke exposure that I talked about earlier, but it also helps those who want to quit actually stick to quitting because they're not exposed to an environment that has a lot of temptation and pressure to continue smoking. So later in the program, Lily is going to talk about how to make changes in your workplace. But first, we're going to hear from Steve Frost, who's going to share his personal story about tobacco.
Hi, I'm Steve Frost. I have 14 years in the construction industry, and I wanted to talk about how I quit smoking and hopefully motivate some people and share my story on how I did it. I picked up smoking cigarettes when I was in my late teens. Both my parents smoked, so it was something that was regularly around my house, and I was kind of used to it, and I thought it was a natural fit, and kind of went out with my friends and smoked a bunch of cigarettes over the weekend. Then I really got hooked and started smoking a pack a day. That over the time, that was just who I was. I would smoke cigarettes and go on through my day to day. And then I got married and had a couple of children, and I wouldn't smoke around them, but I still smoked in my car. And it was around the time that we were pregnant with my daughter, and my wife and I had a long look at things and started thinking, really long term. And we really came together and decided that smoking was not a good fit for our family as well as myself. And it wasn't the best thing to do to myself because it wasn't healthy. And we were thinking long terms. We wanted to have a big family. We have 4 children now. And I was really motivated to kind of turn the corner and look at things in a different light and make some decisions that were difficult. And one of those things was changing some of the behaviors I had, and it included smoking cigarettes. And it was rough. It wasn't easy. It took about 3 years to fully wean myself off, and a few attempts to stop smoking where I would quit cold turkey and then start up again, or I'd start leaning into something else and then, start drinking some more and then say, oh, this isn't working either. There's a gap there. There's a void. And I realized that it's not just cigarettes. There's a couple aspects to the cigarettes. There's financial, there's chemical, and then there's behavior. It's, hey, how much is my body craving this cigarette? How much, when am I smoking? What am I doing? And when am I having a cigarette? And why am I having a cigarette? After looking at it in a long-term perspective and doing what is healthy for myself and benefits my family, I decided to go down that road and start really just taking and dissecting and taking apart the reasons why I was having a cigarette. I got it down to about 4 to 5 cigarettes a day. And it felt good to me because, one, I wasn't supporting industry that wasn't supporting me back. 2, I was making a change, and I was getting off something that I was addicted to. It's not fun to be addicted to something and to think about that constantly. Having to go out and, snowstorm to get a pack of cigarettes is absolutely ridiculous. But I did it. Overall, I looked at the reasons why I wanted to quit, and I used that as motivation, but I took it slow because I wanted it to be successful over time. So I did look at the behaviors when I was smoking, and I found different things to fill those gaps and those voids of, all right, hey, I'm going to wake up in the morning, I'm going to have coffee, and instead of having a cigarette, maybe I'll exercise. And maybe after dinner, instead of having a smoke and going to bed, I have an exercise or drink of water, and replace that with something that's healthy, something that is a better investment for myself and my family over the long term. I did ask my wife, especially my wife and my coworkers, to have a great deal of patience with me, because it was a personality change. It was something where, I'd have to deal with stress differently. And it wasn't just going to have a cigarette and then rebooting and coming back inside and say, okay, everything's fine. I've cleared my head. It was making sure that I replaced that behavior that with something that was healthy, and making sure that I was doing something that benefited me and my family, and making sure that I understood that over the long term, there's nothing good that's going to come out of smoking cigarettes. I really need to stop. I really need to take control of my life and make sure that I am investing in myself and my family. For people that are trying to smoke, just, if you have to try 3 or 4 times, stick with it. The first day you put down the cigarette, your body starts to heal and you start to reap the benefits of it. So stay with it. The distance between you and that last cigarette If you get off that chemical, if that chemical's out of your body, then just deal with the behaviors and replace that with healthy activities. And it worked for me. It's been about 11 years now, and I don't even think about it. I keep going. I exercise, I drink water, and I don't miss cigarettes at all. I can't stand the smell of them. Thanks, everybody, and hope you all have a great deal of success quitting smoking.
Wow. Thank you, Steve, for sharing such a personal story. Steve is one of our Hard Hats with Heart ambassadors, and we're incredibly grateful for his participation in this movement. He mentioned so many things that are important for us to keep in mind as we think about the role of the workplace in supporting your employees, as well as the role of just folks around you, your spouse, your network, your community. So we'll highlight some of that as we talk through the different points today, but we'll start off with 3 proven strategies that a workplace can do. It starts with implementing a tobacco-free policy. We'll dive into the details of what that actually means, as well as improving access to quit lines and tobacco-free resources for users, and then offering tobacco treatment benefits through your health plan with no copays. So as we look at tobacco-free policies, as I mentioned, tobacco not only affects the health of your employees, but it has a huge adverse effect and impact on the company. It impacts the medical costs, productivity, and there are statistics that show that smokers on average take 2 to 4 more sick days each year than non-smokers, and that the annual cost to employ a smoker is an average $6,000 more than employing a non-smoker. So there are a lot of reasons and motivations for implementing a tobacco-free policy in the workplace, because we know that it can rapidly reduce the risk of cardiovascular disease on your job and really gradually reduce that risk for other cancers. It improves productivity and will have a direct and indirect impact. So the 3 strategies that we're sharing here are supported by rigorous scientific evidence, and it starts with adopting a smoke-free organizational policy that ensures no tobacco products are used in any workspaces. So you're including job sites, office buildings, and their surroundings. And then it's covering all tobacco products. So that includes spit tobacco, e-cigarettes, in chewing. It applies to all products everywhere and to both employees and non-employees. So you definitely want to make sure that the visitors that are coming onto your workplaces are aware of these policies too. If you already have a policy in place, when's the last time that it was updated? Because things have changed, as you heard Alexa talk about e-cigarettes, and does your smoke-free policy include the latest tobacco and vaping products? And are you sharing out educational resources to prevent nicotine addiction? That's going to be something we really hone in on here, is how are you communicating these policy changes that you're going to be making? Are you including updates in your employee orientation for folks that are joining your team? Do they know right away that this is something that your company stands by? Is it in handbooks, or are you highlighting this in an all hands meeting? Just making sure that you're communicating these changes, but also engaging your employees as advocates. When you hear Steve talk about his journey, think about how powerful that story can be when you're speaking to a team, having somebody share their own story. And if you're not in a position to implement a policy, so maybe you're joining us today and that's not your role, these are still changes that you can flag for leadership. And the American Heart Association has created a playbook for how to engage and build that buy-in for your leadership. And we dropped that link in the chat for you to check out. So when we talk about improving access to quit lines, it's important to recognize the power of a supportive team when you're quitting. Again, you heard Steve talk about this. It's critical for your leaders, your foremen, your superintendents, team leads, your safety managers to have access to cessation resources on hand and the education to curb tobacco use and really raise awareness of that harm reduction that happens in smoke-free environments. So the AHA has created a hard hat sticker, and we recommend you use it. And I know you all love hard hat stickers, so please feel free to use this. We also have encourage people to print a pocket size guide with the numbers of these quit lines and websites, because using resources like this, handouts like this, the more visibility they get, the more impact that they'll have. So we really encourage you to print the guide, print and laminate signage that lists these cessation tools, put them in visible locations throughout your job site and your office, whether that's near a restroom, a break area. And the guide that we're sharing out, it's available in many different sizes, from a wallet size to an 8.5 by 11. So we will include links to this following our workshop today, and you'll get that all in your email. Ensuring that individuals have access to tobacco treatment is also critical, and especially that they receive it in a timely way and that it's effective. When you share out as a company that you have a cessation program, do employees know about it? How do they access it? And evidence shows that internet-only interventions really do very little to inspire that behavior change. That's why we're encouraging employers to integrate these supports beyond just adding it to a website, but embed these in your actual benefit programs. So the US Department of Labor defines a proven tobacco treatment benefits through the health plan with no copays, and they use the definition and they include 3 things: that it includes a screening for tobacco use, that there is coverage for tobacco counseling sessions that may look like telehealth or in person, individual, or in a group setting, and that it's coverage for all FDA approved tobacco cessation medications when they're prescribed by a healthcare provider. Making sure that e-cigarettes and chewing tobacco users are also eligible for these comprehensive tobacco cessation services, that it's not limited to just smoking tobacco products. And again, back to making sure you're communicating and you're sharing these benefits with people. If you want them to use them, then they need to know that they're there. So we've discussed ways as an employer how you can support, and here are some action items that you can take as an individual. We are going to dive into the education around quitting and spreading the word, how to support those around you who are working to quit, and then being there for someone as they're quitting and even after they've stopped smoking. You have heard us talk about this before. If you are a part of the Hard Hats with Heart movement, we have a resource hub. This is a free online platform with toolbox talks and printouts to incorporate into your safety huddles and your meetings. And these are just some examples of the resources we have on toolbox talks, from how smoking and nicotine damages your body to the benefits of quitting smoking right now, what you need to know about vaping, and then a ton of printable resources around moderation, more information on vaping and quitting. So please visit our Hard Hats with Heart resource hub for any of those resources. And it looks like we can drop that in the chat. So go in there, open it up, bookmark it, continue to reference this site. We update this regularly with materials, and they are all industry tailored. So they are directly meant for you. Another important thing that you can do to support the individual before, during, and after quitting is talking about these different stages. So beginning with the before, when the opportunity presents itself, how are you supporting and referring folks? Because as I said, evidence indicates that mobile phone interventions, quit lines, and lowering those out-of-pocket costs are going to be more beneficial for those evidence-based cessation treatments and more effective versus an internet-only cessation intervention. So once someone said they want to quit, you can help them by talking through a quit plan. And I'll go into depth on the next slide what that is. So when somebody said, I'm willing to quit, this is one way that you can support. And we know this is not an easy process, but here's a template to talk with your team members or your employees about how to stop using tobacco. We really encourage you to start by helping them choose a date within the next 7 days of when they'll stop using tobacco products. So now that's defined as your quit day. You can create a pledge or a commitment for employees, something around, I promise not to smoke or use any tobacco products after my quit day, and then have them share their why, have them share their motivation. Hearing Steve talk about he was doing this for his children, he was recognizing that he was supporting an industry that didn't support him. If people make it personal, then they'll feel a greater connection and hopefully a greater drive to quit. The next thing you can do is help them choose a method for quitting and pick what's best for you. So there's cold turkey, where you're just going to stop smoking or vaping altogether on that quit day that you've determined. And this method works best for some people because it just doesn't drag out the quitting process. Another option is to cut down on the number of cigarettes you smoke each day, or how many times you vape until you just stop completely. So if you started smoking 20 cigarettes a day, you cut down to 10 for 2 or 3 weeks, then you cut down to 5, and keep track on a calendar. And hopefully by that quit day, you've stopped smoking completely. And the last recommended way is smoking just part of a cigarette, because this is going to reduce the amount of nicotine you're ingesting. And if you continue to just smoke part until you stop completely, thinking about how many puffs you normally take on each cigarette and then reducing that. Again, using that calendar to build towards the quit day. And the last thing is really make sure that whoever you're talking with and working with is talking to their doctor to decide whether they need medicines to help successfully quit. And if you're a friend and colleague, you know that it's more helpful to have somebody there to help you quit and help you make a plan. So prepare for the cravings, the urges, the anxiety, the discomfort, the feelings that just come with quitting, because we know nicotine's a really highly addictive chemical and your body will get used to it if you eventually quit. But this person that you can support them with ways to fill their time that they would have normally been smoking. So making a plan to go to a movie, going to work out, taking up a new hobby, especially something that uses your hands like painting or playing an instrument or woodworking. Just getting rid of every cigarette, every vape, every match, every lighter, ashtray around the workplace, around the home, in the car. These are small steps that you can do to support that person. And so for the after, and as we heard, this is an ongoing process. It's not going to be easy, but we heard from Steve earlier how important the role of his wife was and colleagues to be patient as he went through some of those symptoms of withdrawal. And by lending a hand and offering encouragement along the way, you're playing a key role in helping your friend or your colleague or your loved one quit for good. So maybe you have an employee who is said they're ready to quit, walk through that quit plan with them. What should you expect? For a while, we know that ex-smokers can be in a bad mood. It's easy for folks to get angry or nervous or irritable. And that's just part of that nicotine addiction withdrawal, and it will pass. So please try and be patient with them as they're going through this process. It's important to remember, especially if you used to smoke or vape, you can reflect on your own personal experience and how hard that was for you to quit. But every person's path is going to be different. So I urge you never to tell an ex-smoker that he or she is making too much of a fuss about it. That's just not productive. And how can you help an employee who's quit smoking? Well, for starters, people who've just quit tobacco, unlike other behaviors, now they have probably more time, and they also are used to chewing on something. They're used to having that actual fixation. So helping to keep healthy snacks around the office is one really great way. Or if you see somebody getting restless, encourage them to take a break. Give them time to do other activities. Encourage them to take a lunch, go for a walk. You don't need to be watching this person like a guard over them, and nagging really doesn't help, but you can be a great listener, and you can have them talk about their cravings and open the conversation. Talk to them about what they enjoyed about smoking, and then have them talk about what their life's going to be like now that they don't. And if you vape or if you smoke, you can use the website that we have, the resources that we have, but there are so many support systems in place to make sure that you can support that individual for the long term. So we have presented to you all some resources as employers, as employees, and now there is some time for Q&A. And I'm gonna look in the chat here. Wonderful. Okay, so we have a question. I have employees who smoke, vape, and chew. When is the right time to refer them to one of the quit lines? I would say right away. And as you learned today, quit lines are not the only solution. We want to encourage folks to choose that date and make the plan towards their quit day, and keep that pledge, whether you're able to draft something up, some kind of commitment that the employee is writing. Help them choose the method for quitting. So we talked about cold turkey, reducing the number of cigarettes, or smoking only part of a cigarette, and encourage that person to talk with their doctor and decide if they'll need medications to help them successfully quit. And then definitely, last but not least, make plans with them. If folks, they're more likely to not smoke if they have another activity. So if you can help them, encourage them to start a new hobby, go out to dinner, make a plan, that's gonna help drive that quitter to actually make this a long-term change, and recognize that, again, quit lines are one resource amongst many. Okay, another question is, I know vaping is on the rise amongst the younger generation. What can we do to help stop this before they get started, so our future workforce doesn't even see higher rates of tobacco use? That's a great question. I do know that right now, when we're talking about youth, 1 in 4 Oregonian high schoolers have admitted to vaping. So this is a serious issue that's on the rise, and AHA is really doing our job to advocate for local and state and federal policies to counteract these forces that are enabling our younger generations to start smoking again, to vape, just to have access to cigarettes. But in terms of what you can do, we mentioned providing those quit smoking initiatives. So whether you're embedding that in the benefits, you're talking with your HR professionals, your benefits team leads, because access to affordable cessation programs can really help young people quit. And recognize that as mentors and as supervisors, and maybe your parents yourselves, you are a powerful influence. So maintain that dialogue, start the conversation. I hope that this webinar encourages you to actually start the conversation and be honest and open. And also, when you're talking about quitting, think beyond just cigarettes, because the younger generations are very aware of smokeless tobacco and hookah and e-cigarettes, and they all have their dangers and they all include nicotine. And so think broadly, recognize that this is an ever-evolving issue. And then also, it's an opportunity for you to set a good example. So if you smoke or you vape, look up the resources yourself, talk about going on this journey with them, and then at a minimum, don't smoke around them, and show them that smoke-free environment. So whether that is you removing all of those smoking devices and ashtrays from your car or your home, but also just ensuring that the workplace is a safe space for people who want to quit. With just a few more minutes left, any other questions? Well, I will definitely be sharing my contact information at the end of this presentation, and you'll all be hearing from me. So if you do have questions that come up, do not hesitate to reach out. And in these last minutes, if you like today's session, please register for the next training in our series. Our next topic will be diving into nutrition and sugary drinks on October 19th. And you'll see the link to register right there in the chat. So in this training, we're going to talk through those simple steps to get started to on your way to a healthy diet. What's some guidance for meetings or off-site gatherings and food, how to think through nutrition policies, even guidance on vending machines, and then some of those best practices between hydration and nutrition. So at the end of this meeting, just giving you all a heads up, you will be redirected to a post survey, and this will give you a chance to share feedback. Let us know what you learned. Let us know what you think. If you will fill this out, you'll be entered to win a Starbucks gift card. And we just say that to really, really press upon you that your feedback matters. Thank you so much for participating. We want to hear how you'll implement this and what you've learned today. So a huge thank you to Hoffman Construction, Dave, Alexa, Steve, all our speakers. Thank you all so much. And here is my contact information if any questions come up, as well as the link to our resource hub. So we will see you in October. Thank you for all your support.
Listen, baby, ain't no mountain high, ain't no valley low, ain't no river wide.